The first time I called poison control was a couple of years ago when my son ingested some decorative berries. I wasn't sure if they were poisonous or not. I certainly knew that they weren't for consumption. So I gave poison control a quick call, and they were in about a minute they were able to ascertain that they were not poisonous at all, and Richie was fine. When I called California Poison Control, they asked me a series of questions, such as his weight and height and age, and the type of berry that he ate. And quickly they were able to determine that it was non-poisonous. It definitely made me feel better. It calmed me down right away. And the really remarkable thing is about an hour later they followed up with a phone call just to make sure that everything was okay. I'm already having a little bit of anxiety given the fact that I've called poison control twice in 3 years of not being able to use the service again. Poison control must be saved.
I called poison control. I was about 6 months pregnant. My husband was out of town, and I woke up and the house just completely smelled of gas. And it turned out the stove had been running most of the night, and I was panicking. I was pregnant. I didn't know what to do. I thought I might be poisoned, so I picked up the phone, called poison control, and I was very thankful to learn that I wasn't poisoned, and that was a great relief to find that out. I really do believe that poison control is a great resource for parents in California to have.
I noticed that my son had thrown up, and I wasn't sure what it was, and then I realized it was toothpaste. And so I was, of course, worried, to how much he had eaten and if he was going to be harmed at all from eating it. And so I called poison control, and I was able to get right through to poison control and talk to someone. Actually, being able to call poison control kept me from going to the hospital or taking my son to the doctor.
Poison control in California is about to lose all of its funding as part of our state budget crisis. We would certainly be out of business by September 2009, if not sooner, and those calls will go nowhere. People will hear nothing, or they'll get a busy signal and they'll have to decide what they're going to do on their own. There is a serious misconception in California by legislators and others that there's an alternative funding mechanism for poison control. That's simply not true. Losing funding for the poison control system in California will be a disaster for health care and all the people we serve.
The Poison Control Center is open 24 hours a day, 7 days a week, every day of the year, and it's entirely free to any caller at any time. Well, just imagine that you're a parent of a child who has just taken a pill off of the dining room table. You need to know quickly whether that pill is potentially lethal or whether it's harmless. And who are you going to call to find out? You need to act quickly. Parent is frantic, wondering what to do. The first thing I need to know is exactly what pill it is. When I know what that is, I can figure out whether it's potentially harmful or whether it's harmless. If the Poison Control Center wasn't here, then where would that parent get the information? They might call their doctor, but their doctor calls us because we're the ones that have the information about that and how lethal these pills can be. They might call 911. Well, 911 will send an ambulance, but they don't have the specific information about what these pills can or can't do. They might call their nurse advice line at Kaiser or one of the other HMOs. Likewise, those nurses call us for information and advice. They might take their child directly to the emergency room. And guess who the emergency room calls for advice about this kind of poisoning? They call us.
Currently, we can handle a poisoning with about a 3-minute phone call to resolve it from start to finish. That costs average around $40. So in California, that translates to over $80 million a year saved to the citizens of the state of California. Here's a service that with dialing an 800 toll-free number, you have immediate access to somebody with a high level of expertise in managing your poisoning emergency. The Poison Center is a model of the most cost-efficient, cost-effective healthcare delivery system in the country.
I'm a poison information provider, so I take the home calls, which is about 80% of the calls that the Poison Control Center gets. Parents do call their pediatricians, and the pediatricians say, call Poison Control. People call the advice lines, and the advice lines tell them either to call the Poison Control Center or they conference us in. Sometimes people call 911, and 911 conferences the Poison Control Center in. At the emergency room, we're getting calls from the emergency room physicians.
The California budget's in dire straits and many programs are being cut, but it makes no sense to cut the poison control centers. This should be a top priority because the poison control centers save lives every day. But if the poison control centers shut down in California, we're just going to see thousands, I think tens of thousands of extra visits to the emergency rooms costing tens of millions of dollars.
Too many times in a budget situation like the one we face in Sacramento, we're too focused on the dollars and cents rather than the practical effect on people's lives. And the Poison Control Center has that kind of direct effect on people's lives. I don't want to get just focused in the dollars because it's the service that's a value here to people. You know, if your child has ingested something and you're frantic to find what's wrong and what you can do to help, that call in and of itself is priceless. And
it's a very short-sighted decision to do away with the poison control system in California when you think about the fact that they service over 300,000 people annually and they prevent 164,000 visits to emergency centers in hospitals and clinics, etc. And when they save us $70 million a year, just does not make any sense for us to close this down.
Poison control is very valuable in the sense that it's a resource for us to use anytime we have a question about an ingestion, an inhalation, an eye exposure. They're very valuable in terms of telling us exactly how to treat it, how long a person needs to be observed, and even if they need to come into the emergency department to be seen if they call from home. As an emergency medicine physician, the closure of poison control will greatly impede my ability to see the numbers of patients I'm seeing at this time.